Good evening, everyone. You're welcome to Possibilities channel. This is our new channel, and the other day we also told you that a lot of activities will be going on in this channel, and one of those activities we said is health talks. So once again, if you are joining our channel for the first time, my name is Mrs. Obaze Faith. I'm a pastor by the grace of God and also a nurse, a qualified nurse in Germany. And today I have a topic I want us to look into. You know, it's a common topic, and that is antibiotics. You see, antibiotics, they are good products, they are good medicines that the body needs. But these antibiotics can also become harmful to you when you misuse them, when you abuse them. So this evening we want to be looking at it as a topic, and I've been able to make some researches on these antibiotics. I realized that the antibiotics that we know of, antibiotics are actually used, they're actually meant for fighting bacteria in the body. And some of those antibiotics are penicillin. Some of us, those that are in the medical field, they will understand what I'm talking about. Penicillin is one of them, and tetracycline is also one of them. You see, these antibiotics, they help you to fight other bacteria in your body. But there are so many ways people misuse these antibiotics, and that is what we are going to be looking at this evening. So stay with us. I know you will enjoy this time, and I know you will be blessed with it. You see, one thing we need to understand about drug use, there is a way you can use a drug, it becomes harmful to your body. Instead of it producing a positive effect that you want, it can become harmful to you, to your organs, and even make you sick instead of making you well. So this evening, without wasting much of our time, I want to look at abuses of antibiotics. First of all, how can you abuse the use of what is the use of antibiotics, the abuse of it? One of the ways you can abuse the use of antibiotics is by using the leftover antibiotics that you used the last time, maybe the one the doctor gave you the last time when you were sick. You just ran to the doctor and you were able to get antibiotics from him, and maybe along the line you didn't finish it, you still had some tablets from that antibiotics, and the next time you are sick, maybe because you feel you are too lazy to see the doctor or because you could not see the doctor, you use the remaining leftover from that antibiotics, or the one your friends or any other person around you gave you to use. That is one of the abuse of antibiotics. It is wrong for you to use a leftover antibiotics that you kept somewhere before, and you say, okay, let me use it again without seeing the doctor. That is one of the ways you can abuse antibiotics. Another ways you can abuse antibiotics is also when you pressurize your doctor to prescribe antibiotics for you. Maybe as a result of you are experiencing you are falling sick frequently, and as a result of that you feel you should take an antibiotics, and when you go to see your doctor without getting to know what the diagnosis is, you pressurize the doctor, and maybe because the doctor is a family friend, he writes antibiotics for you again, and you keep on repeating antibiotics without taking the precautions that these antibiotics can actually be harmful to your organs when they become overused. So another ways we misuse antibiotics is also when you take overdose from antibiotics. There are some persons, the doctor tells them, take 2 tablets of penicillin to fight, the bacteria, to fight a particular ailment at a particular time, or tetracycline, like somewhere the place where we came from in Nigeria, people can just go over the counter and buy tetracycline when they have stomach pain. As a result of the pressure of the pain, they take more than one dose, 1 tablet at a time. They take more than 2 at a time. That is an overdose. when you use or when you take overdose of antibiotics, they have a way of falling back to damage your organs. They can go as far as damaging your kidney, and I know nobody will want that. So the main aim of the doctor giving you antibiotics is to fight bacteria, and not just for you to become sick after abusing it. So those are some of the ways we can abuse antibiotics. And another ways you can abuse antibiotics is when you take different antibiotics at the same time. Just like I said, I mentioned penicillin just now, and I also mentioned tetracycline. Some persons, because the doctor prescribed penicillin for them at a particular time, okay, they know, okay, when I use penicillin, it will help me with the cough, maybe to clear it, or cortisone at a time, it will help me to free my lungs. So as a result of that, because they have it at home, they take that one and they add it with another antibiotics. At the end of the day, you have double dose of antibiotics in your system. All this overdose of drugs, they go a long way to damage your kidney, to damage the organs in the body. We must watch it, especially for children. Please, it is very wrong for you to give antibiotics to your child without a doctor's direction, without a doctor's prescription. Especially in Nigeria, where people can go to the chemist, they just buy drugs, they get it anyhow, they get antibiotics anyhow. Be careful, because you might not be helping that child, you might be making that child more sick rather than helping the child. So thank God for somewhere like this in abroad, where you don't just get antibiotics being written for you. They have to go through some diagnosis. They have to be sure that what you are, the ailment you have actually needs antibiotics before a doctor will prescribe it to you. So for those of you in Nigeria or in any other country where you don't need a prescription before you can get antibiotics, please take note. When you take overdose of antibiotics, you can make your system to become resistant to antibiotics. And what does that mean? That one means say, if you too take antibiotics, the time go come, your body self, it will come dey used to am. So anytime you take them again, instead of where it go work for you, you not go do anything. Some people they go take one tablet of paracetamol, it go work for them. But some people because their body don't used to paracetamol too much, they can even go as far as taking 2-3 tablets. You know, go be like say they take anything. So there is a level you use drugs, your body become resistant to that drug. So those are some of the side effects of antibiotics when you overuse it, when you abuse antibiotics. So I don't want to make this video to be too long this evening, but I just want us to take something from this lesson this evening, that we should watch the way we use antibiotics. Try not to mix it with other antibiotics. Don't combine too many antibiotics together without a doctor's recommendation. And before you take antibiotics as a whole, please allow your doctor to run some tests on you and see if actually you need it. And if it is not needed, please accept the prescription of the doctor like that, because they are medically trained and they know what is best for you at a particular time. And some of those side effects you get from abuse of antibiotics is indigestion. You start having problem with your digestive system. Another thing is, some persons, instead of antibiotics helping them to clear the bacteria in them, they start having yeast problem. And what do I mean by yeast problem? That is vaginal candidiasis. And that means you start having, some people call it, the common man will call it toilet infection. So when you take too much of antibiotics, it also has a way of making you have this, these sicknesses. And diarrhea is also one of it. And you can have irregular heartbeats. Those are the side effects of abuse of antibiotics. And above all, organ damage. Abuse of antibiotics can damage your organ and can make you sick. And the last thing I want to say before I end this video is that antibiotics is not meant for diseases that has to do with viruses. It is meant for those diseases that has to do with bacteria. But so many persons, when they run to the doctor to give them antibiotics, at the end of the day, the doctor may pity you and just give you because you pressurize him, but it will not give you a good result. So do not use antibiotics for viral for infection that has to do with virus, but rather for bacteria. So thank you very much for listening to me this evening. I hope I didn't bore you with so many words, and I want you to expect more from this channel. This is once again the Possibilities TV. Subscribe, follow us. More things will be coming. We have enough in stock for you. Thank you very much. I remain my humble self, Pastor Faith Obaze. Some persons call me Nurse Brown. Remain blessed. God bless you.